Good morning. Welcome all to our June 2025 Rhodes Monthly Checkpoint, formerly known as the MOTS Monthly Webinar. Every first Wednesday of the month, we run this webinar and at 9 o'clock. It's always nice to have that in your calendar on your agenda. And we like to talk about a lot of things, and we have a nice agenda. And Kelly's going to show me. There we go. That's a lot of points. I'm going to welcome as your host, Piet Vermeer. You probably have heard or seen me somewhere over the years, been here a little while. So we're going to meet the team and we're going to do something with alpacas. We have a webinar series, and the multi-factor authentication is Lisa Tseko's specialty. So she'll be talking about that, and also things to note and how often to submit data. So she's going to have quite a few sheets for you to talk about. Then we talk about the recent updates, because there have been some changes here and there, or you might already have noticed, but it's always nice to have those summarized, and Kayla will tell you all about it. The Rhodes training opportunities that are coming up and that you might have already signed up for, but if you have not, then we'll tell you more about it. Jody, her usual spiel, our EDI specialist, if you are thinking of switching from the portal entry, because today's webinar is mainly focused on the portal entry, but there's always little things going on and EDI adjacent related, so that will come into play as well. Kayla will talk about active episode of care reports and the portal check-in, and then I'll be back with you for questions, how to connect to us, and to thank you for your attendance and all your participation for the day. So why don't we go ahead and let's meet the team. We always have a nice little slide that shows Kayla, our Rhodes system admin, and Jody, our EDI technical expert, and Lisa, the junior system admin. Myself, Piet Vermeer, senior systems analyst. Justin knows everything about reports, is still struggling a bit because our tools are not helping us yet, but every day we make a tiny bit of progress, and progress is always nice to hear. So Anna, who is working with Justin, is also knows a lot about reports and is a good data analyst. And there, of course, you have Mary and Cecilia, our support specialist, and usually the first line of defense against any issues or problems that you might have or questions. And they are the one monitoring with, of course, Kelly and Kayla and other individuals to communicate with you, or if you try to communicate with us. And last but not least, Kelly Wollstonecroft, communication specialist. She's the one who made this lovely slide deck and put together the agenda and does all that communications work. So that is the team. Okay. And the first thing we're going to do is on the alpaca scale. How do you feel today? So what I'd like to see is some numbers to be thrown in there. Maybe you can kind of give us some information. And we always thought this was a kind of a cute thing. Mary feels like a 2, so that looks still a bit grumpy. And I see 7, 7, 8. Somebody's, is that screaming from joy, or is that like, And a 6, pretty relaxed. I like it. The numbers look good. Number 2 looks most groggy. Number 3 is very pleased. I haven't seen a 3 yet. Is there a 3? No. And the number 9 is really sad. So, but myself, where would I put myself? I think I would go with the number 6. Just pretty chill. Anyhow, we thought we'd just put something out there for you for a little icebreaker, and it's always a little fun to look at alpacas and other animals. So who knows what we'll bring out next time, because Kelly was throwing out all kinds of ideas. So we'll be working on that definitely to kind of keep you motivated, interested, and see how you're doing. That's always, I thought that was always fun. So thank you, Kelly, for doing this. Okay, let's go to the next slide. The webinar series. Okay. what we'd like to show is that we are doing these Rhodes Monthly Checkpoint, and it's a new name for the new webinar series, and it's replacing the MOTS CE and MOTS EDI webinars. We always used to have. And why do we do these? Well, we do these to inform you, to keep you engaged and give you any information of things that you might have missed, or um, things that have been going on that you thought you knew, but then all of a sudden things are different and you're wondering what happened. And these monthly get-togethers are using Teams, which is so far is getting a pretty decent tool. We've harped a lot about it in the beginning, of course, but that always happens when a system and a tool is new, and there's some problems, and it has to evolve and grow, and uh, the people building it also have to learn from it, and we have to learn it. But um, I, I'm beginning to like it, so that must be a good sign then, because the older you get, the harder it is to change, they say. So if I'm getting okay with it, then it shouldn't be too bad. And they're making improvements, and it's working better, and and I'm still learning, so that probably helps as well. So, but yes, every first Wednesday of the month at 9 a.m. And what we also would like to know is to learn about what you might have to say, any suggestions you might have, any uh, ideas from talking about subjects, uh, dive deeper into certain information, parts of the information, why we do certain things. We always have these webinars, and we always have, also we have other information. We have, of course, our help desk, but we also have a newsletter that comes out once a month, and that also kind of tries to give you information about what's going on within our system. We changed a lot of things that we used to do differently over the years. In the previous system was a bit more old-fashioned, and when something changed, it was kind of like planned 6 months ahead and to the minute detail, and then we would tell you that we were working on it and that it would come, and then we would make the change. Nowadays, we run into things, and it's more what's called agile. If things change and we realize things are not working as they should, or we've just you noticed, and we've had that one or two times, unfortunately, that somebody noticed, like, hey, something is not right, then we have little mini sprints, and we have little hot fixes, as they call it, and within a very short time period, we can have a turnaround of making an improvement to the system, fixing little issues. So that's a big difference from how we used to do things in the past. So if you have anything that's going on, please let us know right away, because we have become a lot more agile as an organization. And that's also something we had to get used to. But it is also nice that you're not like in a huge panic, like, uh-oh, there's something wrong, and we have to wait 6 months to a year before it's fixed. No, we can kind of have many updates, fixes within a very short period of time. So, um, okay, anything else? Don't think I wanted to add anything else. Okay, I would like to give the microphone to Lisa. She can talk to you about MFA, multi-factor authentication. Go ahead, Lisa.
Thanks, Pete. Good morning, everyone. My name is Lisa Seiko, and let's chat about MFA. I know for some of you, it has been challenging. For those of you who haven't experienced it yet, logging into the portal, please know that this is imperative to have this completed before you try to log in. And for my folks out there who haven't logged in and need assistance with that, or need to get a user name and access to the portal, please feel free to reach out to us in our Rhodes inbox. We are here to support you. And if you currently have MFA set up, but you are facing issues, of course, our first line of defense is through the service desk, specifically that option number 3, because there are techs on that dedicated line that are dealing specifically with MFA. They are absolutely the subject matter experts. We will always do our best to triage any questions that you have, but there's some point where our knowledge ends and theirs increases exponentially. So keep that number handy, save it somewhere. And of course, always, always, always feel free to reach out to us through the Roads inbox. And let me see if I can find that address so we can pop that in the chat for you just in case you don't have it handy, or for some of you folks that maybe still have the old MOTS inbox. And that is all that I can cover about MFA without going too far into the weeds with it. But we are here to support you. We know that it's a new process and we want to get you successful in getting into the portal.
Excellent,
All
Lisa.
right.
Thank you. Go ahead. Oh, sorry. Yep. Keep
That's-
going.
Thank
Doing
you.
good.
Thanks. So Roads, things to note. So correction requests, those also will be going to the Roads inbox for anything like client ID, admission day, last name at birth. All of that should still be sent to us. If you're unsure, again, reach out to us. We can help you sort those things out. And also, this is a great opportunity. What Pete mentioned is if you notice something unusual. We're still refining and growing with Roads, just like you are. So if you happen to come across an instance or a situation where something seems slightly amiss, or you're not able to find a field that you're looking for, or questioning a field, we can give you resources such as our reference manual. But if that's not working and it seems slightly awry, please reach out to us. We can only do better if we know better. And as we get this feedback, we can improve Roads and your experience with it. We have a great team of investigators. In fact, it's one of my favorite things to do. So don't ever hesitate to reach out to us. We want to get this all running smoothly, not only for you, but for us as well. Better, know better, do better.
I
And
like that, Lisa.
thank you.
Know better, do
And
better. I like that.
absolutely. And
Sorry, go ahead.
thank you, Kayla. No, that's okay. I'll take the banter any day. And Kayla just mentioned in the chat that our corrections request form, it will still say MOTS. You will see some forms of communication that may still have that. We are working on finding all of those little MOTS words and replacing it with Roads, but give us time. We are getting there. So some of you may be wondering how often you should be submitting data into Roads. So as you see in our table there, we have a data type and we have the reporting cadence. So any new client that's being entered into the system, it needs to be within 7 days of the admission. That goes for crisis events and involuntary services. And for non-Medicaid services, or sometimes you'll see the acronym NMS, it needs to be by the 15th of the month following the service date. Any status updates should occur every 90 days, end of treatment within 30 days, and stabilization services within 14 days for admission and discharge. And of course, if you have any questions about that, feel free to drop it in the chat, or if you have something very specific that you'd like to know. Also, again, I'm going to keep pitching that Roads inbox. That is how we can assist you best. But after that, I am going to be handing it over back to, I believe, it is Kayla. She's going to talk to us about our recent updates. And I will let Kayla go ahead and take it away.
Thanks, Lisa. Hello, everyone. My name is Kayla Camelli. I am the Road System Administrator. And I am here to talk about some of the updates that happened recently with our latest push, as we call them on this side. We added a number of diagnosis codes that folks said that they needed that were not in the system. Those are listed there. There's 2 Z codes and an F code. We also added a modifier code, a CG Charlie George modifier code was added. We've also added a view in the portal, which is what the screenshot is on this slide, that shows that you can now see clients that have not been updated in the last 90 days. So that little drop down, the value that's highlighted, the arrow, I didn't put the arrow in the right place. That was my mistake. But it says clients in need of update, I think is what it says. It's very small on my screen. But if you click that view, it will show you the clients who have not been updated in the last 90 days. Now we are working on getting a column in this view to show you how many days it has been since that client was updated. Ideally, because if you're like me, you like to work in some kind of chronological order. So for me, if I haven't done a task and there's a number of tasks and that haven't been done, I like to start with the oldest first to kind of get myself rolling. So we're working on getting that in there. It is not in there yet, but we're working on it. And then we've also added in our report, in the dashboards, I believe, the total row is now working and it wasn't working before. So these are kind of large scale changes that I thought might affect portal users more, but we do have the full list of system updates on this page. And so when you receive this PowerPoint after this presentation, you'll have access to that link and it's posted on our website. So if you're curious what else happened that isn't on this slide, you can find it there.
Looking good. Do you happen to know what CG stands for?
I do not off the top of my head. It's like a policy requirement. It's not an acronym is what I learned.
Okay.
It is something else. Yeah.
I think they ran out of those options, I think. So yeah. Okay. Thank you. What is next? Kelly, roads training opportunities.
Yes, thank you, Pete, and good morning, everyone. So there are some roads training opportunities for you. We have this monthly checkpoint, and it alternates portal entry, and then the following month will be EDI. But then we also have an introduction to roads that is kind of like if you were a MOTS user, we used to have the intro to roads the second Wednesday of every month. So we're keeping that cadence and doing an introduction to roads. And if any of you had joined our roads portal training sessions, we're sort of merging those now. So it's an intro to roads with also a portal training portion at the end. So this is great if you need a refresher, if you still have questions, if you want kind of a high level overview of roads, and then if you want that hands-on kind of going through some of those steps of entering data in the portal, that is for you or any of your colleagues that would want to join. So we're having that the second Wednesday of every month, our intro to roads. Also, if you need some other training resources, we have those on our website. We have video tutorials, which are super handy. We have our user guides and a lot of things to support you. So we'll be putting a link to that in the chat, and definitely take advantage of those if you need a little self-paced resource or refresher on something. We have a lot of those materials there for you. EDI training is in development, and so keep your eyes peeled if you're an EDI provider, that those are in development and on the way, so be on the lookout for some communications regarding that. And I think Jody Kramer is going to be speaking in a little bit, and she might have more to say on that subject as well. But lots of resources for you. Again, also, as Pete mentioned earlier, we also have our Roads Navigator, which is our monthly newsletter. And so that's also a great way to get some resources and information. So if you're not already subscribed to that, please do so. You can pop your email in the chat if you want, and I'll get you added to our mailing list. But yeah, we're here to support you. Please reach out also to our Roads inbox if you have questions or need help. We're here to support you and make this transition into roads easier and smoother. So thank you.
Thank you, Kelly. And you were absolutely spot on. The next slide is for Jody, switching from portal entry to EDI. Go ahead, Jody.
All right, thanks. Good morning, everybody. Jody Kramer, as everybody said, the EDI person. So anyways, if you're considering changing the way you send data to MOTS or roads, as we call it now, from portal to electronic data interchange, we have a few things. Hold on, I'm gonna take a little sip of tea. Hold on.
That's okay. That it sounded like there was a little frog in your throat. So
Yeah, or more than
plenty of
one.
frogs out there in Willamine, I assume.
Yeah, that and a bunch of stuff. Yes. So if you are thinking of switching from the portal to electronic data, let us know of the change. Like even if you're out 3, 6, 12 months, it doesn't matter. Just kind of let us know. We can keep it on the radar in case anything comes up that might be pertinent to you because of that. The electronic health records and roads functionality, when you're looking, if you're like looking at different EHRs, maybe your organization is, you know, looking at 3 or 4. Some things that we found from others that is helpful is maybe ask when you're doing your evaluation and the demos, instead of them saying, yeah, it's compatible with roads, like what's the actual process for this functionality? Like, how does it really work? How does it work from the time your client steps in your door, gets some services, and then how does that get sent to roads? Like what are all the processes along the way to make that happen? And when you ask these type of questions and look at it, you'll find out how much staff time is going to be required, and then you can figure out who's going to do what steps before you go live, before you've got everything up and running. And these 3 things that I've mentioned, it's not that there's one way that's better than another. There are just a lot of different workflows and processes that each of the electronic health record systems or electronic medical record systems have and use. So it's just nice for you to know up front how much staff time will be involved or not. I know there's the myth that you go to EDI and you don't have to do anything, and that may or may not be the case, but by asking these questions, you'll definitely find out. The next thing, when you let us know that you're thinking about changing, it helps us to meet your project timing. We also talk about your process of how you're going to go from entering into the portal, where we change you to EDI and then we get you up and running. We'll talk about that process. We set up what's called a secure file transfer protocol. It's basically a little mailbox on our server here at the state that either you or your system, depending on which one you go with, submits your data files to us so that roads can be like, hey, there they are. I'm going to pick them up and process them. You also will want to talk about your client IDs, because currently you're probably using certain client IDs for each of your clients in the portal. And sometimes when you go to EHR systems, they may be assigning one. Some call it a master index number, some call it a master MRN. There's different names for it that are like driven by the system that you choose that gets sent to us. So if that's the case, then we talk about how we can update those, change them, what options we have. Defining your business processes, that's kind of just a helpful PSA, public service announcement, but by asking the questions when you're looking at the different systems and choosing yours, then you can define those processes so that you're ready and locked in place once you go live. We'll test your files through EDI, because regardless of which system you choose, and it doesn't matter how many people they already have using it and submitting to roads electronically, we test your particular files so that we make sure that any type of customization, mapping, or different things that maybe you set up for how you are doing your business aligns with the specifications. So once we test those files, you go live, and then we schedule some follow-up, because once you go live, you're going to be getting real messages and information back. How do you interpret those? How do you look at those? Where can you view those now in the roads portal? A lot of really great things. And so those follow-ups can be weekly, bi-weekly, monthly, whatever you want. But they are helpful while you're doing the real-time submissions to be like, okay, well, we got these. I got a question, like, what does that mean? Where do we go to fix it? That type of stuff. So definitely a lot of folks have found value in that. I'm usually the one who's going to be working with you when you're switching from the portal to EDI, but with Pete Vermeer back 100% on roads, we have Pete as well, who was really my mentor in the very beginning. So you'll be in good shape. we'll make sure somebody's available for you and your project. So I'll turn it back to you, Pete.
Thank you, Jody. Thanks for the great explanation. There were a couple of questions that popped up for you, and one was about Qualifax CareLogic, and Yvonne asked a question like, how do we find out about the configuration? It also sometimes depends because there are several versions of EHRs out there, and it depends on which one your organization is adapting and which ones, which modules and which parts are actually working. Sorry, Jody, you wanted to jump in?
Oh, I was just going to say that. So Qualifax CareLogic, they are configured for roads. Any of the EHRs that were configured for MOTS are configured for roads because roads is picking up the MOTS legacy files. And so CareLogic is kind of like they have a setup that they implement across each provider, but they definitely are configured. InSync is not configured. I see the comment from Valerie. They don't have a clue what roads is. And Therapy Notes, I don't believe they have anything set up yet. And as one of you asked, like, how do you know? You can always ask us. We have a list of the EHRs that we've been working with, and that isn't a list of preference. That's just a list of alphabetically who we work with, whether they're submitting or not, and some contact information. So we definitely are impartial, neutral. We do not care which one you use, as long as if you're going to do EDI, it comes in properly. And if any of you are using ones like Therapy Notes, you're mentioning maybe switching to that. Pete and myself, we are always available to chat with those EHRs that currently aren't set up for EDI and to talk about what those possibilities will be. And even though we might have talked to them in the past, it's probably worth new conversations with them, because now some of these, like Therapy Notes, there's a few others that come to mind, InSync, they and Athena, they are not set up to do it, although I do know an organization that is doing like a third-party solution to get that to work. So we're happy to give you that list, and we're always welcome conversations with your EHRs to see what is possible.
Thank
Sorry
you,
to
Jody.
just take over, Pete.
Okay, last way ahead. No, that's good. You are much more up to date because I've been out of the picture for a little while. And Kayla already jumped way ahead of us and dropped the list of EHR vendors for EDI that we currently have and work with in the chat already. So if you have any questions, and if you have one that's not on there yet, invite Jody and or myself, and we can talk to them, to talk to the vendors, and we can give them information. We can always there to assist you and start the communication. And some take a long time to develop something. Some can be probably very quick because they might have things already in there. We don't know until we actually sit down and have a nice chat with them. So okay, thank you, Jody. What was next? The next one was active episode of Care Reports. Kayla, Camille.
Thanks, Pete. So I am stepping in for Justin King today, who is out, but is our main report guru. The reports, the active episode of Care Reports, should have been distributed to facility primary contacts on June 1st, but there were some issues caused by a server error, so they may have been sent the 2nd or the 3rd. Crisis submission summaries and involuntary service submission summaries should have also been sent on the 2nd, although some may have been blocked and will go out later this week. So if you haven't got it yet, don't worry. We're working on getting those sent out if they were blocked for whatever reason. The non-Medicaid service submission summary will go out June 15th. We are working on finalizing all the other types of reports that folks used to receive when MOTS was up. So we're still on the on the runway there for all of our reports to be going out. But a plus is that automated reports can now have more than one recipient, which is different from how it was before. So if you want more than one person receiving a report for your organization, just let us know. And then we can make that happen.
Excellent, Kayla. Thank you. Yeah, and also one of the things that we are working on are the actual reports online in this road system. There's a dashboard that we have with some information, and we're still working on improving them and making them more helpful and giving you better and more information about some brief overview of especially the active client list has always been a big one, and we would like to have that in the system. So whenever you want to do a check or work on some of the reports, some information, they should be out there. And if you have any suggestions, would like to see certain things, please let us know, and maybe we can work it into one of our next sprints and see if we can improve on that. So please let us know. Okay, then the next one is the portal check-in. Kayla, you're still up?
All right, so this is really just an informal check-in on everyone here. If you use the little React button, we just want to know if you've been able to log into the portal. Have you had any issues? The road system is still fairly new, right? We've only been live for about a couple months here. And sometimes our team only knows when something isn't working correctly if someone tells us, because the way the portal works is that our team isn't ever in our production environment. That's the environment that our providers are in, that you are in. So if something isn't working the way you expect it to be working, or you think something should be behaving differently than it is, take a screenshot, explain what's going on, and let us know, because sometimes we won't find it unless someone tells us that it's wrong. And that's just kind of the nature of this beast, is that we need everybody's help to make the system work as efficiently as possible. So this is really just a thank you for those of you who have done that in the past. Over the past couple months, we've communicated and had lots of good conversations with providers who are explaining that the system needs to be able to accommodate XYZ, or it's not functioning the way that they expect it to. And that's where all these fixes come from. I guess not all of them. Sometimes we find them, sometimes you find them. But ultimately, we're all on the same team, trying to get the system to work as it should. So if you ever have a question with anything, feel free to shoot us an email at that Roads inbox. If it is a system-specific hang up or glitch, try to take a screenshot, explain the screen that you're on, because that's what we're going to that's what I'm going to have to do anyway, to communicate the issue to our contractor to help them, find the culprit. But it always gives me a leg up if I can get more information from you when you see the problem happening. It makes our digging or our detective work less invasive on our side. But that is it for the Roads portal check-in, I think.
Sounds good. Thank you, Kayla. I saw a quick question about involuntary service reporting. That is usually done by the counties, and they are civil commitments, court mandated information that we get, and individuals who through certain events are mandatory required to start taking treatment. But it's not that many treatment providers who report these, but they are out there. So hope that is enough information to answer the question that I saw pop up. Okay, anything else? I saw a lot of thumbs going up. That meant when the question was asked about who can log in and who cannot. So if you cannot, please send immediate, and you really need to get into the system to make sure that the data is current and everything is working properly. Send definitely a question to our help desk, and Is there anything else popping up? Anything that I missed? I think I got most of the information out there while the others were doing the chatting. If you have a question coming up later, because that happens a lot, to me at least, just use our help desk. And I think that's the next slide where we have the information, the Rhodes email, rhodes@odhsoha.oregon.gov. Any questions, any issues, any suggestions? Also, what when Kayla was talking, that popped in my head is if you've been working with the system for a little bit, and all systems are different, but if there are certain things that you think that could make your life a lot easier, please let us know. We have built the system, and it's always a give and take with the developer, like, okay, we would like it this way, and then they build it just a little different, and we kind of say, okay, well, it's working, so leave it for now, and go on and make sure that we get a system going at a certain time. So if you have things that run into you, it always helps a lot, and it helps us a lot if we get from multiple providers similar stories like, hey, can you do something about this, or can you do something about that? And then we can maybe put those things together, put our heads together and say, okay, how can we optimize that part of the system to make everybody's life easier? And if we have a group of people who are asking it, then we can say, hey, this is a request from our people that work the most with it. So maybe we can help and make that system a little better and a little easier to work with. Because we know one of the things, it is paperwork and it has to be done. And we know the most important part, of course, is to treat individuals and help them to make them better and help them get better and be better people. But if we don't have that information, we don't know what is really going on. So we really need that information. So, but if we can make life a little easier, that would be wonderful. So, okay, did I miss anything? Don't think so. Okay, there's a question.
Yeah.
I saw one pop up. What was that about? A timestamp? When you received our data. I think there are timestamps in the system, aren't there, Kayla, that there's like an audit history. Is that available in the portal, or is that just available in the background?
Elaine, is this for ED? Are you an EDI? Do you report using EDI or the portal?
Portal.
EDI.
There should be a date when the file is submitted, if I'm not mistaken. Is that correct, Jody?
Which, yeah, so when the
Yeah, it
file
has a
is
date, right?
actually, yeah, when the file is actually submitted, there's a date that the system captures for the date that we, actually got it. But also within the file itself, there is usually a date in the header or at the top and the bottom of the file that is like the date their system actually put on it for, because like maybe it was generated a week ago, but you dropped it in to your mailbox, right, yesterday. So sometimes those dates might be different, but definitely in the portal, you should be able to see a date in that submitted files section for when it processed.
Yes, that's one of the huge improvements of Rhodes over MOTS. In MOTS, there was hardly any information about the submissions, but in the new system, you can see a lot more and have a lot more access. And that's why we're asking everybody to make sure that you have access so you can go in and see all the information that's out there.
Yeah.
Okay, so this would be for the entire file though, not line item, right? So what our problem seems to be is if a close and an open go up in the same file, we don't know how the line items are processed because we're getting our closings are being rejected, but then we're over here trying to figure out, okay, was an opening submitted for a different case on the same day, and how are you processing that? Is it just top to bottom, or like we were looking for a timestamp to see like which line items went in, because that would explain, okay, I still have case 001 is still open and you don't even register 2 or 3. Okay, how did this happen? I sent a closing this day, but when did the opening for 3 and 4 go? So it just increases the time that I spend trying to figure out my error report, basically.
Elaine, which system are you using? Which EHR?
You ready for this? Braintree.
Oh, okay. You're with Yamhill County, right?
Yes, ma'am.
All right, right.
We're fixing
So,
to change. We're fixing to change, but we're
yeah,
kind of
I
bogged
did
down in
yeah, I
contracts
did
right
get the
now.
memo that you were swapping to
Yeah,
something here in the near future.
yeah.
So Elaine, how that works is I'm not exactly sure how the logic or who set up your um, file compiler essentially for Raintree, but typically what MOTS does, or Rhodes, excuse me, still correcting myself, um, is when the file is created, um, Rhodes will look at the first line and go, okay, it's batch number X, and this is the date that they provided that they created it. And then it literally goes from top to bottom. So whatever order you folks have put those openings and closings in the file is how we process them. It doesn't go through the file and look for an opening and match it with a closing. It just goes
Okay.
from top to bottom. And then what also can be a little tricky is if, let's say, if you have an opening and a closing in the same file, right? But
Yes.
there's an error with the opening one, right? Then that'll air out and then the closure won't have anything to match it to. So
Right.
that's kind of what you need to look for. But do you have access to the portal yet?
Oh yeah, I'm in there every day, all day long.
Okay, gotcha. Well, and if you want to set up, a time with Mary and I, we can, step through kind of how we do some of the looking and how stuff is. We'd be happy to do that as well. But that's how the file is getting read and processed, is from top to bottom.
Okay. So if there is a closing, see, I don't think you guys look at case either. I don't know. I'll have to set something up because it's our air
Yep.
report, albeit very, very small compared to what it was when I got here, is still a significant expenditure of my time. And I'm just trying to figure out ways to make it go quicker.
Okay. Feel free to reach out to us and see about maybe setting up a time that we could just chat with you and we could give you some ideas. And then I think when you go to your new system, barring we sit down and talk through exactly how that works, this should be less of a lift for you once you get to the new one, which
I
doesn't start
agree.
today.
Yeah, we're still contracting back and forth, back and forth, back and forth. So I'm not
Oh,
sure
yeah.
when that's going to happen.
Yeah.
So I'm
No
in
worries.
workaround mode in a lot of different pieces of what I do. So this is just
Yeah.
kind of another one.
Yeah.
Thank
Well, I think,
you.
yeah, you're welcome. I'm good, Pete.
Cool. Thank you. Okay. Yeah, no, I was just trying to see what was going on. Okay. So yeah, if you have any questions like that, try to make an appointment, send in an email to set up an appointment with Jody, myself, Mary, Cecilia, Kayla. Kind of depends if it's portal related, if it's EDI related. Always make sure that you have Jody and or myself in there to ask those specific questions. So, okay. Anything else I missed? I think it's looking good. Okay. Well, wow.
Yes, there
That went
is a
quick.
question
Oh,
in the chat.
sorry. And that is about, can you confirm that the Rhodes team has met with / provided Rhodes configuration to all participating EHRs so that the EHRs can update their modules for provider use? The easy answer is all MOTS approved EHRs can send the same file to Rhodes. We made Rhodes, that Rhodes V1 version 1 we called it, will accept all MOTS files that were confirmed and were given the go-ahead and approved, because you have to
My
do the
que-
certification and then they all come in. So for the next phase, we are working hard on
Um,
documentation to get the V2.
So my question wasn't really actually related to the portals. It's related to the modules that the providers use to enter information into the EHRs, because they are designed for MOTS. And if there were any new questions or anything like that, they would need the new update so that we could, so providers can go in there and enter the information into the EHRs.
So is this for, Yvonne, is this for portal users or for EDI users?
I would imagine portal users, that's what I didn't understand the last time we had a meeting, is that the portal wasn't EDIs, but I'm understanding that now from this meeting, that portal, it was referred to as manual entry last time, and because we were uploading files, I didn't see that as a manual process. You know what I mean? So, but I understand better. So yes,
Yeah.
it appears that we're using the portal.
Which EHR do you have? Sorry, Yvonne.
It's the CareLogic one, the Qualifax CareLogic.
Okay, and which organization are you with? I'm sorry,
That's okay, no worries.
I'm
Yeah,
blanking.
no worries. Oregon Community Programs, and
Okay.
we have, our users, we have, for lack of a better word, clinicians that go in and answer all the MOTS questions. In the EHR, there's a tab and we go and answer all of that. And then we have our really well-trained, competent portal submitter. And she's on the meeting here today. And then
Okay.
she goes and she takes all that information and it's put into a file and she submits it into the portal. So my question is about just having that module piece where all of our, like where our clinical people will enter information,
So-
about the client.
Yeah. Okay. So, first of all, the EHRs that we have been communicating with, the most heavily are the top 5 that hold about 78 providers, which is CareLogic, Credible, Dr. Cloud, Ochin, and ReliaTrax. We've had one-on-one conversations with them and one-on-one meetings with them and all of their partners, with the exception of Dr. Cloud. So they're very familiar with where we're at and what we're doing for the build for the electronic data side, what they're going to, kind of what our timelines are. I see Shelley popped in the chat as well, which is relevant to your question. The new documentation for version 2 is coming out this month. We do have the data dictionary locked down, and we are just going over the last finessing of the file specifications guide. That's the 2 are like companion guides to one another. Now, so Shelley, in June-ish, okay? So then if you're actually manually entering data in the portal, like you're using the screens in the portal and you're putting the information in for the clients, we in the past had not been asked by, say, for example, InSync or Therapy Notes or Simple Practice or these other EHRs for information. Now, with Rhodes, some of them have. InSync said, well, we want all of your documentation. And so what we realized is that they're using those documents to build screens in your EHRs, but they don't really do EDI, right? They need to know what it is so they can build the screens in those so that at least you have them to collect and then, enter over. We have a reference manual that is out and readily available on the public facing website. Maybe one of our teams could throw that link in the chat here. We have notated that document is not for EDI development, but it will have all of the fields, about probably 95 it's probably about 95% everything. The only things that aren't in there are the burn network fields that we have added here of late, but that will have all of the new questions. that you may have for the behavioral health details, things that went away, you know, that'll have, and it'll have the why and the how and the reasoning behind it. So that's the one document we do have published that, again, is probably 95% complete, just because it's missing the BERN, which is the Behavioral Health Resource Network, for those of you that do any of those services.
So my understanding, it helps a lot. So my understanding is this roads reference module that the link was provided for. Our EHR will also have what all the new questions are, and by middle of June is what I'm hearing. And that then they can begin work on updating their EHR so that all of the questions and that are new from roads are implemented in there. And
yes.
Yeah, okay, great.
Yeah.
Thank you
and
very
those,
much.
And that documentation was supposed to be out in April to May timeline, but because the BERN stuff was added back in, leadership decided that they didn't want to put out the documents and then 2 months later give the EHRs all brand new documents. That was, you know, anyhow. So that's why they're delayed somewhat. But yes, CareLogic is fully in the loop. Jessica Coleman with CareLogic and Paulina Silverstein is with Credible, but they're both under the Qualifax umbrella. So they're kind of helping one another because Paulina is very, very, very knowledgeable with the state reporting.
Great. Well, thank you.
Well,
yeah. Thank you very much for that timeline. Then we just know what to expect with our, with our EHR too. And well, for anybody really that has an EHR that's, that's participating.
Yeah. And we have met with the others outside of the top, I call them the top 5 just because they hold so many providers. But we have been in contact with the others as well, the ones that are using NextGen, NetSmart products. There's a slew of them. So
thank you very much.
Yeah, feel free to reach out to us though. We're happy to get back to you or connect with you. I think we talked with you here about a month ago, right? We came in and
Yes, we talked about it a little bit, and I was going to reach out to you with email, but I didn't have your email address. And then I saw this meeting was coming up, and I was like, oh, well, we'll just address it then. But I have a better understanding now. Like I said, I originally thought that we were not manual, but portal does mean manual. So
no worries. Yeah, absolutely.
Thank you, Vaughn. Yeah, we should try to make a distinction between checking in roads for your EDI information and actually using the portal, because you kind of log into the same system, but you have different rights and you can only see certain things in there. So maybe we have to work on that so it's more clear and more evident that what we are talking about actually, because you go into the portal to see your EDI submissions as well. So
yeah.
it becomes you log into the system, so it gets a little blurred. So
it definitely
we have to work on that.
Yeah.
Cool. Yeah. Excellent. Well, thank you all very much. This was very helpful and very wonderful. I really enjoyed it, and we're definitely running out of time. Again, if something pops up, roads email roads@odhsoha.oregon.gov, and you can just drop your whatever question you have in there. And I hope to definitely see you next month, and have a wonderful rest of your day. Thank you very much.
Thanks. Thanks, everyone.
Thanks, everyone. Bye.
Thanks all.
Bye.